Welcome to your final week of Intro Psych. This is actually week 15 and 16. Week 16 really is just Monday's class, which is when the final exam is due. So you'll see it's labeled week 15, 16. In this final week, we're going to be covering chapter 13, Psychological Therapies. So last week we covered all the different disorders and mental illnesses, and now you're going to get a closer look of how treatment works for each particular category of mental illness. So chapter 12 talked a little bit about certain approaches to mental illness, and a lot of those approaches likewise have the same named types of therapy. So you'll see humanistic theory or perspective on mental illness, and then you'll see humanistic types of therapy done, as well as psychoanalytic, cognitive behavioral, and so forth. So you're going to see a lot of the same terms coming up, which hopefully will be familiar and helpful in remembering a lot of this stuff. So if we take a look at the week, here's the objectives for chapter 13. You're going to get a little bit of history in terms of how have we typically approached mental illness and psychological disorders, and then how has that evolved into what is used today, mainly two broad categories of therapy used today that we see kind of across the board for the treatment of psychological disorders. We'll take a look at psychoanalysis as a main way of approaching mental health issues through the psychodynamic approach. And how has that evolved? So it'll talk about some early work and then kind of what it is today. And then we'll get into humanistic therapies, also known as person-centered therapy and Gestalt therapy. They share some of the same veins and points of interest in terms of how to approach the individual and what types of goals one would be working on within therapy. We'll also be taking a look more at some of behavioral approaches. So how might classical and operant conditioning be used to treat disorders? Can be used for many different types of disorders, anything from anxiety to depression, but the focus here is behavior. And that kind of harkens us back to the chapter on where we covered classical and operant conditioning. This might be a point that's helpful to go back to that chapter that covered those terms and those concepts, and kind of just make sure that you're understanding how it relates to then, all right, how do we use these tools to treat a disordered behavior? Now that we know what classical conditioning is and how that works, how can we use it to our advantage in treatment? Then we'll skip on down to talking about cognitive therapies, where the goal is more working with what the person is thinking, the idea being change the thoughts, change the behavior. And then we'll look more broadly at group therapy. Group therapy can be effective for treating a number of disorders and is beneficial in terms of people being able to talk with others who suffer the same symptoms, same maybe even backgrounds and other elements that might be contributing to the psychological disorder. And so it really is helpful, but not advantageous for every person. There's definitely advantages of individual therapy. And oftentimes people might be getting individual therapy and then also be participating in group therapy, maybe once a week or once a month or something like that. So you'll be looking at sort of the advantages and disadvantages there. Psychotherapy, including cyber therapy, which is a newer construct. This idea that we can be doing therapy even online, a little less intrusive. So some kind of pros and cons there. Whether or not therapy is effective, that's the big question I think many people ask, especially those who are embarking on a therapeutic journey and struggling with a psychological disorder might say, well, am I going to beat this? Like, is this going to be effective? Is it going to cure me? Those are some very strong words, but really the effectiveness is based on the individual. It's based on lots of factors about the individual, personality, how willing and motivated the person is to get better per se. But it'll be looking at some of that, and then as well. So these are all really therapy-based approaches, and then we'll talk about medically based approaches, the use of drugs to treat psychological disorders, often the two working in tandem. So it can often be the case that a person is on drugs to treat a particular disorder, but also receiving therapy. In fact, that is the most effective means for many psychological disorders. I'll talk a little bit about electroconvulsive therapy, psychosurgery, other different biomedical techniques that sound a little scary and oftentimes can be an extreme option, but can also be a very lucrative option in terms of once done, it may actually very much so help the person to operate at a normal functioning level, to lead a semi-normal, quote unquote, life. And then just, looking at some of the pros and cons there. And then lastly, we'll end with virtual reality for treating psychological disorders. Very, very effective, especially for anxiety disorders, things like PTSD, finding some good success there. So I think you'll find that interesting. Here are your lecture slides for the chapter. The videos that you're going to be watching this week are all in episode 17, which also talks a little bit about some of the historical perspectives on treating mental illness as well. For your discussion this week, you're going to be reading Hawk number 34, titled Relaxing Your Fears Away, which basically looks at systematic desensitization as a type of therapy for treating anxiety and treating phobias in particular. So I really think that you have an opportunity with this reading, number one, to read about the research, how effective is this technique, making sure you're citing, but then two, a chance to pull in some material from earlier in the semester, particularly chapter 4, where we covered learning, talking about the acquisition of a phobia. How does one get a phobia? Where does it come from? And a lot of what we understand of that is related to some of the learning principles that we've discussed throughout the semester: classical conditioning, operant conditioning, observational learning. So all of those come into play. So I'd expect to see a lot of integration here from the textbook as well in chapter 4. And then say based on some of these, how we learn these phobias, what kinds of therapy might be useful to treat them. Okay, so here again, you want to be citing the research as well. Okay, and then you have your quiz this week, which is just on this last chapter, and you'll be covering chapter 13. It's due Friday on the 4th. And then your final exam, this final exam covers 3 chapters. It's chapter 7, chapter 12, and 13. And that is due Monday. So that's Monday of week 16. There is more questions on this final exam, although it's not cumulative. It is just covering those 3 chapters, but there's 45 questions in total. So a little bit different from a normal exam. That is it. That's the week. I really want to just say that I've enjoyed this class. I've enjoyed interacting with you all, whether it's been just on the discussion boards, or whether it's been getting to know some of you in my office hours. That's really been great. I don't always get to see my students face-to-face. Sometimes we get distance learners, but it's always special, I think, when I can, and several of you have been coming in regularly this semester and meeting with me. Some of you I've just been talking with over emails during office hours, so all of that has been really great. I've gotten a lot out of this class. It's been fun seeing people's different perspectives. That's the great thing about teaching intro psych is everybody is usually in different majors. I don't always get psych majors, so that's something that's really neat. So just want to say you guys have been a great class, but please feel free to reach out in the last week here if you have any questions pertaining to anything. Final grades is usually the big question. Your final grades will come out by the registrar. Once your exams are done, you get to see them right away, so there's nothing new there. But your final exam grades for the class will not be done until the registrar gets those in and submits them and posts them, and they'll notify you. Usually it is the week after finals that you would find out that information. So please don't email me and ask me what your final grade is, because I may not know, and I really will be taking that time. I have 3 other classes to do grading, and so it's all a matter of when I get to finishing this class and calculating final grades. But anyways, please feel free to reach out and contact me if you have any questions this week. Otherwise, have a wonderful summer if you're off this summer, and enjoy some sunshine. Thanks, everyone.